Welcome guys to today's video. My name is Adam, I'm a medical trainer and mobility coach. Today with me is Negar. She is a professional tennis player in international league. Yes, she's training in here for how many years do you train already?
7 years.
7 years, okay. And you travel around the world and you play with...
Yes, I play tennis in all the national tournaments.
Okay, so today she came to see me because recently she has a pain and a little bit discomfort in her shoulder, right shoulder and the neck. Of course, with the high performance athletes, very often it happens that when we play in the tennis, especially we use this rotation, so we overuse one part of the body, especially the front shoulder, and then our neck becomes tight and stiff. It may provide to the discomfort as well. We know that we do this rotation kind of, so very often we put a lot of pressure and tension on the hip, the rotation one side and also shoulder, yes?
Yeah, you're right.
Very often as well in tennis, the elbow, it causes problems. So we can have a tennis elbow, yes, pain, and then as soon we develop in here issue coming from the hip, then we also have this function, the scapular, that very often we see in those athletes that the one scapular is bigger, is higher, yes, lifted because a lot of pressure coming to the one side. Yes, like we say that we use overusing by holding the racket, and we do these forces with the shoulder to one side. So as we can see that one is completely different, and then the whole motion and then the whole system is gonna look different for us, and it's gonna put much more pressure. So we need to. So for us, it's very important to spend time on mobilization to bring back proper function for the muscle and release those muscles and this tension, to be able to bring this proper posture in here and in the same time strength. So we need, after the mobilization method, we need to focus to be able to strengthen those shoulders, rotator cuff muscles, so the four muscles which are responsibility for stability and proper rotation. If we talk about here the movements, rotation, yes, capacity in here, or rotating shoulder that way, or even lifting and going from here, yes, or pulling down. In this element, in this sport, is going to be very crucial for us to build the strength, stability, and mobility to prevent injury and as well increase this performance. Okay, so for first thing what we can do is if it's going to be offset, not before the competition, but as a post-therapy after training or as a preparation for the competition, it's going to be very good to add the mobilization methods. Okay, so what we want to do the single ball thoracic region mobilization and for the scapula. So when we have this ball, we can place, the athlete can train by themselves in here. If you're gonna go to the physiotherapist, they're gonna go and do the nice manipulation in the scapula. But if you want to mobilize and work, systematic work is gonna give you also better results that you need to do this by yourself to be able to hold this in proper position and helping yourself whenever if you feel tension right before the start or before the training, to release that and feeling and increasing this strength. So what we want to do with the ball, we want to go around. As you can see, there is a scapular. So close to the bone edge, we want to go all the way here. So from the front, starting from the upper trapezius, so almost on the neck, going down, 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 all the way and around. This is very often that in here, we have a lot of trigger points. Shoulder rotator muscles, yeah, rotator cuff muscles, they're starting from this place. So if our scapula is not functioning properly, very often we have a lot of tension coming right here. Yeah, so we develop this dysfunction in our body. So to bring it back to the normal position, we need to go and manipulate here. So we're gonna go from here, 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 and then starting, and as well in here on the back of deltoid, and then is a connection with the one of the rotator cuff muscle is also running this way. So we can find in athlete that there is gonna be a painful area. Yeah, so at the beginning we're gonna focus that way. So we're gonna demonstrate how to do it by yourself. So we're gonna lay down on the back. Now we're gonna turn, flip over. Exactly, you want to pull the ball directly in this place, yes? So right under the scapula, here, where was this border, yes. You can find, but it's not on the bone, but remember that it's not on the bone, it's between the spine and between the scapula. Yes, head is down, so we need to relax our head totally. And what we're going to do, we want to increase in here range of motion for the shoulder, so the shoulder is gonna move. Yeah, so as soon we change the position, the ball is here, and you can already probably feel. Yes. Remember about the breathing. That's the key. Is in here breathing, going up. Yes. Bend your knees together. Bending, coming. Okay. And now we go. Yeah. So from here, 1, 2, 3, and you can already feel that there is a lot of tension. You're gonna find those spots. So the key is to spend the time looking for these corners to release this tension. Yeah? Head needs to be relaxed. Yeah? So head, try to push down. Because if you're gonna keep forcing with the head and neck, you're gonna bring in more tension on the neck. So what we're trying to do, we want to increase this by our movement. So adding a lot of movements, rotation, moving forward. That is gonna help us to replace this fascia, restore this fascia much better, more efficient, and improve the movement for the shoulder, for the scapula. Yeah? So what we were trying to do here, going then forward all the way, yes, and try to move, yeah, like so up, got the rotation, going down, here, yes, and going to the side as well. Yes, it's gonna change the game totally. If it's 1, 2, yes, 3, 4, 5, 6. Also what we can do, we can lift our hips up to reach even more. It's gonna be more harder because we're gonna put more pressure. So lifting up and now try, yes. Up. Remember about breathing. Yes, let's say you found already, yeah, the place. So if we are feeling the pain in here, we can stop in this place and just deep breathing, breathe out, releasing, yes? And then coming with the nice rotation inside, yes? Up, loose, yes, and then going in, up, yeah? If it's very painful, you can go a little bit lower, but you try to, your body will tell you how much you can apply by yourself. Well, great thing about this technique is that you applying to yourself, so you should know the difference between the big pain and the difference when you loosen up the muscles. Yeah? And every breathing, you can like even fold more into the muscles with the movement, so you can, yes, make this tissue more soft and hit directly the trigger points. Because the trigger points in here is limiting us from the proper movement, and then is building compensation, what we want to avoid. 1, 2, 3, 4, then sideways, yes. Then we can go even across. We can put the hips down, 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 and then we go across, yeah? So here, 1, 2, 3, 4. Because with the racket, very often you do this movement, yeah? So going here, across, and over, yes? So that's why we need to make sure that if we put a lot of pressure there, and as we making our muscles in this movement overworking, so then we need to bring back this proper function for our shoulder and release this tension in the same way, how we're bringing tension, yes? Then we can also add shoulder holding up and add even rotation like this, yeah? So 1, 2, 3, 4, 5, 1, 2, 3, yes. Okay, and if we have more tension on, for example, on upper traps, like we checked before, so we can go with the ball a little bit higher. So we want to place the ball a little bit. So as we remember that we go all the way from the top to the bottom around the all scapula. So if we change the position, we can feel the difference as well, yes? And then we want to increase in here the shoulder range of motion thanks to this. Trying to go with the shoulder higher, over, yes, inside, and rotate, and going 1, 2, 3, 4, and 5. Very good. And again, deep breathing. Yes, and going over. Yes, breathing is gonna be very important in here to be able to loosen up this tension. Perfect. Okay, now I'm gonna show the next mobilization. So the other one, so we have a sit for us on the sitting position. Okay, another very important component in here is gonna be, we have a back of deltoid, which also becomes in here, if it's overworking, becomes very tight. I can feel that there is a tension here, yes, and it causes the pain in here. And there is also rotator cuff muscle, which is running all the way up, yes, and also is connected in here, is going through the joint. So if the shoulder is overworking, that is pain. Eh? It's important to increase this. You remember when we were doing this mobilization?
Yes.
When the first time when I was working to mobilize your shoulder, and you told me first thing what you told me, it was a pain on the back of the shoulder. Yeah? Lay down like this. Yes. So the first thing when I was doing here, and I was working to increase the shoulder range of motion here. So whenever, if we even do this slipper stretch, or someone is working on you, you are feeling pain on the back.
Yes.
So that was exactly, that was the rotator cuff.
Yeah,
that was, yeah. So do this, like you say, the physio was telling you to do this one. Back, there was a slipper stretch, yeah? Here, that one. So if you have on the back side, the one of the rotator cuff is very overworking and it's tight, it's gonna cause you pain on the back of the shoulder. So before doing a slipper stretch, this, enforcing yourself, it's gonna be very crucial to go with this ball, release this tension first before going that. Then you're gonna avoid this pain. So let's go back again. Okay, and so this point is gonna be directly here. So we want to place the ball here in this place and immobilize that area. And then we can also add a lot of rotation with the shoulders. So going down, 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 here, okay. Now you want to lay down on the side more, yes? So being on the side, okay. Yeah, so you here support yourself here. This one you can press, and now you're working with the rotation. Now you're feeling, yeah?
Yeah, so much.
1, 2, 3. Oh, so much pain. So make it at the beginning easy. So now we have a mobilization methods what we can use right after the training and as like a post-workout therapy in the same time. Preparing ourselves, like giving a nice rehab for our body to prepare for the competition. Because competing with those tension in the body, it can lead only to the injury. If we're gonna keep forcing, yes, our shoulder for too strong, yes. So very important is that we try to prevent our shoulder from the front, popping on the front, yes. So making sure that this stable, stabilize, and then we improving this rotation here and other side. So internal, external rotation, yes.
Yes.
Up and down. Then we can check if we can also change a little bit in your position. And then with the shoulder, we want to go straight and back, yes? So like you want to improve, what we want to improve in here is the protraction, retraction of the shoulder. So going forward and back, forward and back. So self-treatment, self-work, it can improve a lot. And then we can try to bring the shoulder all the way overhead and going down. Yeah, so a little bit correct the position here. Yes, and then from here we want to go 1, 2, 3, 4, 5. Yeah? If you want to find a place that is very painful, you can even just hold your head here and stay in this position, and only focus on breathing and rotating as well. 1 and 2. Yes, 1. So as we can see, our athlete is struggling a little bit, so there is a lot of tension.
Yes. It's a pain.
Yes. And 5. Okay, perfect. So this one we have, and also for the neck, yes? I will show you now releasing. So if we have a problem with the scapular, 100% first you're gonna feel that overworking is upper trapezius. So this muscle is gonna give us a lot of pain and trouble at the beginning, and we may think that this is a trouble, but that's why we're focusing, because the main reason why this tension is growing, that those muscles in here from the rotator cuff muscles were not functioning properly, not working, so the scapular was not really rotating in a proper way because there was no proper stability, and the mechanism was breaking up, so that's why the pressure was coming up and was affecting us, this tension on the upper traps. So to loosen up at the end the neck tension, so upper traps, we can go with the ball into the wall. That's a technique. We want to go with the ball here. We're gonna find a corner like this, and we can work in here that we're gonna place the ball directly here. Yes, we can go lower a bit, yes, add the body weight in here, and then we're gonna find this corner here, place down, and with the shoulder we're moving, 1, 2. And now try to press there,
got it.
Okay. You can still hold the ball, and then you go with the shoulder all the way up and all the way down. Now, deep breathing up, deep breathe in, breathe out. All the way up, and down. So from that side, we are pressing with our body, keeping the spine neutral, that's very important. Movement, adding the movement, so we breathe in when we're going up, and then breathe out going down. It's gonna help us to get to this point much more effective, more deeper with the ball. Yes, up, down. And it's already targeting, yes, these points in here. We can try to move a little bit, yes, with our body as well here. Yes, and when you breathe out, you press into the ball. So then you feel you can go soak into deeper to the tissues, to mobilize fully. I recommend to spend about 2-3 minutes on those mobilization. As soon as you loosen up in here, all of these corners, you can feel the difference. Then we can start doing a stretching. Then the stretching is gonna make sense. If soon we're gonna restore the fascia, release the trigger points, then we can add the stretching to finish and feel better. Yes, we can add the rotation, very good. So you can feel, you already feel that you can go with the motion in here. Yes, adding the rotation. Yes, one back, very good. Yes, so we want to stretch out the neck and make our shoulders depress down. So we do the depression with the scapular. Yes, the head we're putting on the other side. Yes, and then chin is down, chin is down, chin is down. Okay. So as you can see, we are stretching, mobilizing here. The shoulder needs to be straight, so putting on the place. Yes. So the weight is putting our shoulder down, the scapula, and is improving our stretch in this position. So about 1 minute with the deep breathing. Yes, then we can change also the position of our head, so it can be all the way down, pressing it down. Yeah, so one is can be down, one can be to the side, and other one that the chin is all the way down, 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 and we look up. Yes, that very often this one is the most effective here. Yes, and that's why it's essential. First go with the ball here, loosen up, and then same like I would do the myofascial release in here, thanks to the stretching, and that is gonna be the best. Another stretching technique. We want to place the elbow, yes, on the top, here across, and then with this leg we want to stand up to the front, yes, and with the body we want to go forward, holding, yes, that is going to allow us to really mobilize our shoulder and scapula at the same time. With every breathing, a little bit pulling and losing, yes, in here. So 1 minute in that position, deep breathing, allow yourself with each time a little bit more spending, so go a little bit more forward. Of course, if the shoulder is gonna go like this on the front, it's not good. Yeah, we need to control in here. Loose, okay, again. Okay, and then we can add the movement, so the elbow is gonna go to the side. So we can do great mobilization in here for the shoulder. Yeah, so adding this movement allows us to mobilize in here everything around. Yeah, so now we can also stretch our neck in this position. So we can go with the head to the side. Yes, we're gonna go forward in. Press a little bit, elbow down, 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 down. Okay, yes. In here you can go a little bit higher. Okay. And now we can feel that we have different type of stretching, that we stretch in here chest and neck in the same time. If we pull our head more to the side, now we can feel it. Yeah? That is. And you can also rotate your body to the side. Yeah? So you want to facing that way, the shoulder, elbow is staying in this place. Yes. And another mobilization more for the lats. We're gonna involve the shoulder is gonna inside. You're gonna hold it, wrap it in here, and the same leg is going to the opposite. Yeah. So we're gonna stretch. This is very important, especially for those athletes which are doing those motion and these rotations. Like for you, like you are very often in this position. Yeah. When you with the racket, you holding here. So you have not only the shoulder problem, but also hip is very often, yes, imbalance and is very tight. Yes. So the glutes, to be able to stretch the glutes, all the muscle tape, we're gonna in here involve shoulder and hip and lower back in the same time, mobilization. So same leg, same shoulder, side, and we're gonna turn, we want to face in here. Yeah? Now we're rotating to the side, head is down, we're rotating the side, shoulder here, yes, but if you feel too much tension, that means you need to come a little bit closer, yes? Yeah. Hold it here, but rotate inwards like this. Okay, very good. And now looking up, yes. You feel stretching, yes? Yeah. Here, this muscle tape is going into the stretch, yeah? So opposite hip and opposite shoulder. All the way from the lats. This is become very stiff, especially in the sport. That kind of mobilization will be great to add with the movement right before we're gonna start playing, yes? With this movement, to mobilize, to warm up our ligaments. Because we need to remember, but not bending elbow, only shoulder, only scapular. So only scapular movement, yes. Yeah. And add the rotation as well. Add the rotation with the shoulder, here, yes. And head is down, and is going up, looking up, look up, look up, look up. Yes, don't force your neck, very important. Adding the scapular movement here, but elbow straight. Yes, elbow straight, and also in here, you want to involve this rotation into the movement. So rotation to already strengthen our rotator cuff muscles in the same time and loosen up them to create more space in here. Okay, so we're looking, yes, here, yes, in this position. And looking up, you look up, but the head is down. Yes. Very important is at the beginning, secure the athlete in that position to learn the proper pattern movement. And then as body is gonna learn, yes, then it's gonna be perfect to add right before the competition or before the training. It's gonna be crucial in here to mobilize our scapula to shoulder to prepare, add mobility and stability in the same time. Straightening those tissue in here. Yes, up and loosen up the tension in here, stretching at the same time. Yes, the one side which is more affected by those rotation in the hip. Yes, and then up. Okay, now we can go down on the knee. And now we look up, you look up and rotate. Rotate, same way here. And now we are up, yeah, in this position. And this leg we can bring to the front more. Leg,
front?
yes, to the front. So make it bigger lunge, lunge, lunge. Yes, more lunge, yes. More lunge position, looking up in that position, yes. And we find even difficult a bit, yes? That is, you're feeling more stretching in the hip.
Stretching.
Yes. And we can add this mobilization here, this movement, to provide in here active stretching at the same time, yes? Still mobilizing, head is down, and in this position, we improving in here hip function at the same time, shoulder rotation, yes? Opening the T-spine, so thoracic region in here, and shoulder, opposite. Exercise, doing on the both way for about 2 minutes on each side. Perfect, okay. Yes, and we're stepping up. Yes. You want to try other side? Very often we find that the one side is hard.
It was very hard,
Yeah.
more than tennis.
Yeah?
Yes.
Mobilization can be also like a workout.
It's very,
Must
yeah,
consider. That's why when people ask me like at the beginning, they should do actually just a separate class.
I think
Yeah.
it's another thing.
Yeah.
Yeah.
But as soon as you're gonna get used to this, is like a great warm-up, yeah? It's not difficult anymore, yeah? This one, here, hop, and then we go down, like this, hop, one. And you see I'm doing the trunk rotation in here, yeah? So I'm involving this trunk rotation, and then adding shoulders open. One, yes?
Yeah.
Two, and then I feel directly here on the hip, yes? Opening the shoulder, improving whole rotation for the body. And also by pulling in here, improving scapular function here. And looking up. So first we're gonna do one side, this one, yes, that one, and then we're gonna go down this. Rotate and looking up, yes, up. And then you want to involve this rotation here. One, yes, open, two, slowly, three. Yeah, no rushing with this one, slowly, yes, and going up, breathe. Add the rotation of the shoulder, pull the scapula, yes. In, 3, 2, last one. Tie the glutes in here. If you squeeze these glutes and push the hip forward, yes, that is gonna give you better effect, yes. So a little bit forward, squeeze the glutes, and then more rotation involving, yes. Very often the shoulder problem and injury starts from the tightness in the hips. So we need to remember to mobilize the hips and working as a globally joint by joint therapy to fix any issue in our body. Very often fall into the injury and the elbow is in pain. So this is a floss band which can help you to improve and restore the fascia which is damaged. Maybe you feel when you're holding the racket sometimes you feel pain because you're putting pressure and forcing one side. Yes.
Yeah.
See if you feel this is the hand which you hold the racket. Yes. And then we can add quick mobilization right before the play to help us to release this tension and the pain. So we can start right above the elbow, going with the full movement that we can apply in here. So we need to make sure that this one is actually going to be compressed quite strong.
Yes.
Yes, not too strong of course, but it must be held properly to block a little bit our circulation, then to improve. Now we want to add a lot of movements here, yes? Feel the trouble a little bit, yes? We want to go here.
Yes.
So all of the movements that we require have is coming here and here, yes? So adding a lot of here, 1, 2, 1, 2. It really helps us, this band, to stop the circulation and improve the, in here, fascia, so restore the fascia thanks to this Floss band technique. So working about 2 minutes until that you're gonna feel that in here the blood is not coming back. You feel that it's gonna be So then we need to take off and check again. Yeah, so hold it. So I highly recommend to do this right before you're gonna do training or competition, even 2 minutes, and you're gonna feel the difference on your elbow. Especially if you already feel some tension, yeah?
Yes.
100%. So here, then up, you want to hold it, up, yeah? Try to go work by yourself, no? Hold it, up, moving. Now you feel that already, yes?
Yes.
You're losing a little bit?
I lose my hand.
Yes, you're losing hand. That's the time that we need to take off and check how is it feel. And even after one time, you can feel the difference, yes? So one time, it would be enough, yes? And see how if you feel more loose, yes,
Yeah,
the
yeah,
elbow.
I think so. It's very fine right now.
Yes.
But I think it's a very different practice.
Yes.
Okay, thank you so much.
Okay.
Okay, take care.
Hope you have a exercise to do. Yes. And check the
every
Instagram.
day, every second of your practice.
Trying to keep the.
It's making magic. Yeah, it's a magic.
Now you are preparing yourself for the competition, so you're going soon.
I'm going to Ontario.
Yes, you're competing.
Yes.
Yeah, so we're gonna hold. I'm gonna watch. Instagram is.
Yes, I will. I will share it.
Okay.
And I will introduce to my friends to do everything every time. This practice, it's mobility. We're growing the muscles and injury.
All right.
And really thank
I'm gonna keep watching how you play. Hopefully you're gonna win.
Hopefully.
Yes.
Yeah.
Okay. Thank you.
Thank you.
Okay.
Thanks.
Nice.